Now, let me invite Dr. Sini Regi Thomas. She is a special educator and head of the Department of Special Education Needs at Trivandrum International School. With over 15 years of experience, she has pioneered many educational initiatives, earned many awards, TESS Award, and and she's a recipient of the Inspire 3 Special Educationist of the Year Award. She's also the first Keralite selected for Perkins School for the Blind prestigious Global Education Leadership Program. So, welcome, Dr. Sini.
Thank you. Good afternoon, everyone. After listening to so many technical terms, I was like so shocked, maybe like some of the videos. So hats off to all the ophthalmology surgeons. So my goodness, such a wonderful job you all are doing. So you all will be wondering like what a special educator doing in this conference. So first of all, my hearty thanks to Dr. VKP Geeta for giving me this wonderful opportunity to meet you, such an awesome population. So myself, Dr. Sini Regi Thomas, I'm heading the Department of Special Education in Trivandrum International School group of institutions. So last year, I was so fortunate to be selected one expert from India to attend the Global Educational Leadership Program in Perkins School for the Blind, Boston, USA. So CVI, cerebral cortical visual impairment. I'm not a person to talk about the more technicalities, so I'll be more talking about the educational management side. So it is a brain-based visual impairment caused damage to the visual pathways or visual processing areas of the brain. So it is now the leading cause of blindness and low vision in children. Recent studies estimate CVI may affect as many as 1 in 30 children in mainstream elementary schools. This highlights the urgent need for awareness and adaptation in inclusive education settings. Inclusive education, children with disabilities studies in regular schools along with their neurotypical peers. So let's look at the educational implication. To truly support children with CVI, we must focus on tailored educational approach. I know that earlier speakers, they were also like very focusing, they were telling about the customized approaches to make learning accessible for them. It can be in terms of curriculum, assessments, physical education, then adapting the environment, creating classrooms where children with CVI can learn without any barriers. These principles form the foundation of effective inclusion. CVI poses unique challenges for educators. As Christine Roman Lancy says, CVI is a disability of access, specifically access to the visual field. Children may struggle to visually engage with learning materials, interacting with peers and their environment. To address this, educators must adopt customized strategies to ensure both these students can actively participate in schools. Let's explore 5 key strategies to support children with CVI. The first one, need for individualized support. Each child's experience of CVI is unique, shaped by various factors. For example, lighting or visual fatigue. There are 16 visual behaviors are mentioned in the Perkins CVI protocol, and then the development of individualized education plan in collaboration with specialists in essential. So in our school, each student under a SCN program, they will be having individualized education plan. Let's go to the next principle, that is multisensory learning. CVI limits visual processing, so children often rely on auditory and tactile inputs. Incorporating hands-on activities, sound cues, and textured materials can greatly enhance learning. Classroom adaptations minimize distractions like visual clutter or poor lighting, We should be very careful while adjusting the lighting. Majority of our children are having seizures as well. And then use high contrast materials and structured environments to support their processing abilities. Then it is very important to modify the teaching learning materials. We have to simplify the complexity of the visual representation, use large font and spaced text, and mark the salient features. These adaptations help children focus on the key details. So you can see this is one of the strategies, like a word bubbling, the presentation of the materials in a black background. And usually we will be using, some of the students will be having difficulty in neck control, so we will be using a slant board in front of the child so that it will be very easy for the child to look upon. Next is, if you see the tortoise, and then the child will be finding difficulty to understand the end part, so we can do the marking. Use of assistive technology, tools like screen reading or magnifiers enable access and promote independence. So some of the key points to remember, there are additional consideration to keep in mind. Children with CVI need time to interpret and process visual information, avoid rushing them. When they come to the school, often the early intervention starts very late. So when they will be coming to us, like the teachers, we have a tendency to ask and talk a lot. So we will be having a strategy called wait. Wait means, why am I talking? So we have to process and then pose questions and then process for 1 or 2, 4 seconds and then talk next. Functional vision, teach strategies for visual scanning and recognizing key features to maximize their residual vision. Address frustrations that stem from visual challenges by offering positive reinforcement and encouragement. Teachers must be trained in CVI-specific strategies, functional vision assessments, understanding on Perkins CVI protocol, and then CVI range, and attends inventory through workshops, hands-on training, and resources. Hardly I can see all these things are incorporated in the visual impairment, the teachers of visual impairment curriculum. My hearty acknowledgements. Before concluding, I want to acknowledge those who have guided my understanding of CVI. Their contributions remind us of the importance of collaboration, of creating an inclusive world for children with CVI. In conclusion, when we adopt our teaching and learning approaches in classrooms and attitudes, we can create meaningful learning experiences for children with CVI. By incorporating these considerations, we ensure they receive equitable opportunities to learn, participate, and succeed alongside their peers. Thank you for your patient listening.
Thank you very much, Dr. Sini, for your wonderful presentation.